Hello and welcome to this brief tutorial on Essential Evidence Plus. To access Essential Evidence Plus, you can simply click on the link from the library's homepage under Clinical Resources. You no longer have to create a personal account to access Essential Evidence Plus. To make sure that you are logged into Essential Evidence Plus as a Frontier user, click on the menu icon in the upper right-hand corner. As long as it says Welcome FNU User, you should be good to go. Go to the search box at the very top and then type in your search term. The search results in Essential Evidence Plus are going to be separated into some major subheadings. The first one is going to be Essential Evidence Topics. The next part is going to be Decision Support Tools. And then there may also be diagnostic test calculators, history and physical calculators, poem summaries, and any Cochrane systematic review results that pop up as well. For the purposes of the physical assessment class, you probably won't need to worry about the poems research summaries or the Cochrane reviews. We're going to focus primarily on the essential evidence topics, the decision support tools, diagnostic calculators, and the H&P calculators. For example, let's go ahead and click into just a general essential evidence topic on pharyngitis. All of the topics in EEP will start off with an overall bottom line. And basically this is going to be a very brief series of statements. And after those brief series of statements, you'll see the evidence ratings of either usually A, B, or C. Now what these evidence ratings refer to, if I click on one, for example, it'll say sort A, and then there's a little learn more area where you can click on to learn more about the sort taxonomy. So these are the evidence grading schemas that are used within Essential Evidence Plus. The one that you'll see primarily is the one here on top, and it's called SORT, and it stands for Strength of Recommendation Taxonomy. So after each recommendation, usually in the overall bottom line, it will have like an A, B, or C. And A is the best level of evidence, consistent, good quality, patient-oriented evidence. And you can read further down here what EEP considers patient-oriented evidence. B is going to be inconsistent or limited, so that's your mid-level. And then C, if you were trying to equate this to the evidence pyramid, is going to be the base of the pyramid. So it's going to be consensus, disease-oriented evidence, maybe usual practice, or stuff like expert opinion. Going back to our evidence topic here, which basically acts as a summary, once you get past the overall bottom line, you're going to have some other choices to look at closely. The second section is usually calculators and algorithms. Under here, you're going to find like clinical decision support tools and calculators. Some of these calculators are designated as H&P calculators. We'll look at that here closely in a minute. And some of them are going to be diagnostic calculators. You also have a choice of looking at algorithms. This particular topic doesn't look like it has an algorithm associated with it, but some topics do. Beyond the calculators, you're going to get a section on background and epidemiology, screening and prevention. One of the sections that's probably going to be very important to you in physical assessment is the diagnosis section. EEP does a very good job of presenting the overall diagnostic picture as the overall bottom line, but they usually also supply a nice table talking about the differential diagnosis and the using the history and physical findings to narrow down your diagnosis. The rest of the topics are usually devoted to like treatment and prognosis and references. So for your physical assessment class, you're probably going to use most of the content that is in the overall bottom line or maybe all the way down to the diagnosis section. If we wanted to take a closer look at some of these calculators specifically, let's go back to the calculators and algorithm. I'm going to click on one of these H&P calculators for sore throat, and it's a H&P calculator that's geared towards trying to basically rule in or rule out group A strep as the cause. So if I click on that calculator, what that opens up for me is an H&P calculator for group A strep, and it's going to have the tests sorted out by something called LR positive, LR negative. So likelihood ratios that will pop up in your evidence-based physical diagnosis book by McGee. So we can sort the test by that, so the likelihood ratio, or so that's a rule in if it's a likelihood ratio positive, or we can sort it by ruling it out, and that will change the way that the calculator is presented. We can look at the most sensitive versus the most specific. And if you don't necessarily want to look at this calculator by individual tests, you can click here to show the entire test summary. So if I click this link that says show test summary, it's going to just basically expand it to all of these tests. So for example, if I were to look at a history and physical, so this would be like a physical exam indicator, palatine petechiae. So basically like little petechiae on the top of the palate. It will tell me that the LR positive is 1.4, the LR negative is 1.0, and the sensitivity is 7%, and the specificity is 95%. And then it can go down through all the different indicators. And if you're unclear on the definitions of what those mean, there is a brief definition of these indicators here at the bottom. So it'll tell you what a positive likelihood ratio means, a negative likelihood ratio, versus sensitivity and specificity. Now, you may not end up using every single aspect of these calculators, but you might look for likelihood ratios in sensitivity and specificity. So that's basically what the calculators and algorithms part is for each topic. I think for this course in physical assessment, you're going to be primarily tasked with finding evidence that supports your physical assessment, like history and physical findings. And you're probably going to want to be able to explain kind of what the sort taxonomy is. So just keep in mind that anytime you're in EEP and you see an A, B, or C linked after like a recommendation, you can just click on that to get more information about what that means. Similar to Dynamed, if you see little numbers, those are just numbers to actual individual references. So those are going to be referencing individual articles that the editors and authors of EEP use to formulate their guidelines. If you have any questions about EEP, feel free to reach out to the library. We're always happy to help. Thanks.